The purpose of this video is familiarizing the parent and therapist with putting on the brace. First thing we're going to do is make sure that the shoes are on snugly so that we can control the internal and external rotation of the legs, as well as the plantar and dorsiflexion of the foot. If they're laced loosely, we're going to have some pretty poor control. Next thing we want to do is kind of open up the brace and get it ready to slide underneath the child. So I'm going to loosen up these calf shells, the thigh lacers. Now the pelvic straps, open those up, and the chest straps. We want to lie the child down on their back and then lift them up underneath the knees and slide the brace underneath them. When we do this, we want to make sure we put the hip center at the pelvic center on the brace. When we strap up, we're going to start at the foot and work the way towards the head. First thing we do is bend the knee of the child and the brace. We're going to attach the two screws at the bottom. The back screw goes into the slot at the back. That's the first thing you do while it's bent. Slide it in there, and once it's in, you push at the joint center by that bolt there, and it rotates the other bolt into place. I'm going to tighten this up with the Allen wrench included, and then move on to attaching the calf of that same leg. When we attach the calf, we're going to take the front shell, place it so that it's opposite the back shell. If you can look back behind, there's a little piece of plastic showing where the back piece curves around. They're lined up so that the Velcro will actually hit that dot. Centered on their leg, rotate it around a little bit, and then put the strap around. That's holding the front piece in position. And now you want to put this kind of snug around here to hold their leg in position. This needs to be a little bit snug because it's going to be the main control. The next thing we want to do is look at the positioning of the leg. You can pull it too tight. It's not necessarily good to pull it like that and strap it on. You'll wind up tweaking the child's leg, which is not necessary. So let them be in a more relaxed position unless they have a tendency to knee inward. We're going to do the other leg in a similar fashion. Allen wrench on the bolt, and then work on the calf. Okay, now we're going to move on to the thigh lacers. We're going to straighten out the clothing, wrap the unit around the back. Normally we go outside of the rod, that's the femoral rod that holds the joints together there, around the outside. Tuck in excess material. Hopefully we'll cut that off. The orthotist will if there's too much material underneath there. Snap it in position, and shouldn't have to be adjusted from time to time. It should be a setting that's acceptable to the child. Then we're going to move on, after finishing the thighs, to the pelvic section. Again, straighten up the clothing, otherwise you get bunched up underneath there. Attach the buckle and then pull it so that it's snug. And this you probably have to adjust every time. Loosen it and then pull it so it's snug. And the same thing at the chest. Snap the buckle, loosen it so that it's snug. And we should be ready to go.